Any other questions on topic?
For the senators, we've heard a lot about the states of if this bill does pass. Can you talk a little bit about what, if anything, Senate Democrats can do to prevent it from passing? What are you guys planning to do?
So, Eddie, right now, it has passed the House in its current version. It's going to the Senate, and there's a lot of pushback in the Senate. There are a lot of folks who understand, even on the Republican side, that this is a real problem to make these kinds of cuts. So our job at this moment is to raise the stakes here so everyone across this country can see exactly who's going to be hurt and exactly who's going to be helped by the Republican budget. We really want to underscore this is about taking away health care from newborns so that Jeff Bezos can buy a third yacht. And that's something that I think most Americans, whether you live in a red state or blue state, are not in favor of. And that's what we want to underscore right now at this minute, so that while the Republicans are at home with their constituents, not having town halls, we want them at least to hear nationally about what this bill is all about. And the only way we can do that is to raise it. We will talk about it on the floor of the Senate. We've already had hearings. Senator Markey has been part of this. I've been part of this. But this is the moment to talk about it. And then I just want to make sure you know where it goes from here. If the Republicans change the bill but pass it, it will have to go back to the House again. So we will then keep the focus as well on all of the House Republicans. Remember two things. When this bill passed the House, it passed by a single vote. A single vote. We get just one Republican in the House to go the other way, and this bill does not make it through. But also remember 2017. I know how frustrating it feels. Republicans are in control of the White House, in control of the Senate, in control of the House, but that was true in 2017 when they went after Medicare and Medicaid, the Affordable Care Act. And you may remember, it passed the House. They all went over and celebrated with Donald Trump, popped the brewskis. I mean, what's not to celebrate about taking away health care from millions and millions of people? It came to the Senate. The Republicans had a majority. And at the last minute, we won it by a single vote. Not because we had somehow more Democrats than we'd had before, but because we got the word out. And we got the word out all across Massachusetts, but all across the rest of the country. And that's what we're here to fight for right now. Ed, what else can I add?
All issues go through three phases: political education, political activation, political implementation. Until last Thursday night, Friday morning, no one was quite sure what was going to be in this bill. Will the moderates win? Will the reasonable Republicans win? Or will they have to capitulate? Well, now the story is clear. The cuts to Medicaid are draconian. The cuts to SNAP are draconian. The tax breaks to billionaires are the highest in American history. So the storyline gets very simple as we move to the political education phase over the next couple of weeks and then to the political activation phase, because all across our country, in facilities like this, in purple states, in red states, there are going to be meetings, and the hospital CEOs, the community health leaders, the behavioral health leaders, the community leaders will be talking to the senators about the implications for their medical facilities. So it's no longer just theoretical. It's no longer just the political debate in the salons of Washington. Now it's very real. We saw this in Massachusetts with the Stewart health crisis. We saw them loot the hospital system in our state. We saw Neshoba Valley go under. We saw the hospital in Dorchester, Kearney, go under because of millionaires and billionaires who wanted to loot the system. Well, this is the Stewart health system on steroids across the whole country. It's a looting of the healthcare system for the wealthiest people in our country. And I think as each day goes by in these red and purple states, they're going to see what the political consequences are. And this time, we have evidence that proves that when the Medicare cuts happened in 1997, by the scores by the hundreds all across the country, hospitals went under. I just named 3. And by the way, who goes under? It's those that have the most elderly patients in them because of Medicare, and those who have the working class who use that facility as well. Those are the facilities which go under, and we're going to have a battle on the floor of the Senate. And Senator Warren, when she gets to the microphone, people back up on the Republican side because we're coming loaded for this fight. We're not going to back down, and I think ultimately Republicans are going to see that they're going to proceed at their own political peril. And Massachusetts is a perfect example with Stewart of what has happened.